Hello friends, right now I would like to explain you about endocrine system in pathology, which is in the endocrine system we will be talking about pituitary gland, thyroid gland, parathyroid gland, pineal gland, adrenal gland and male and female reproductive systems. So right now let us first deal with pituitary gland. As you all know, in anatomy you might have learned the morphology and general features of pituitary gland, which I'll deal it in anatomy class. So right now I would like to explain you about what we will deal in pituitary gland first of all. So first I would like to deal you first with first endocrine system. In the endocrine system, first I am dealing with pituitary gland. So, pituitary gland, as you know, what is pathology? Pathology is something derangement from the normal. Any derangement from the normal which is not physiological is pathological. So, right now the main derangement here which we will be going to talking about are mainly three things. One is hypopituitarism, the other one is hyperpituitarism, finally tumors of pituitary. So first I would like to discuss with you the hyperpituitarism. What is hyperpituitarism? That is increased production of pituitary hormones. You all know what are the pituitary hormones basically. Pituitary hormones basically consists of growth hormone, thyroid stimulating hormone, corticotropic, adrenocorticotropic hormone ACTH, prolactin, vasopressin, luteinizing hormone, follicle stimulating hormone. All these are the hormones which are secreted by pituitary, both anterior pituitary and the posterior pituitary. So right now first we will deal with each and every hormone and its effects whenever there is hyperpituitarism. So first hormone which I would like to discuss with you is the growth hormone. So whenever there is increased growth hormone, what happens? So whenever there is increased growth hormone, there are two things, that is two pathological events which are happening basically. One is gigantism and the other one is acromegaly. I hope you all have read these disorders in your past classes when you were in your primary classes. So we'll just go it at a first faster. So one is gigantism. So gigantism is increased secretion of growth hormone if it's before puberty. If there is increased secretion of growth hormone before puberty, then it is called as gigantism. Here the body will be large. He will be very large and he might be very high and very large, who weighs around 100 kgs or 200 kgs or 300 kgs. So they are very strong. First, in these gigants where for whom there is increased growth hormone before puberty, for them first pituitary giants will have increased pituitary secretion. It may be due to tumors or the reason may be anything. Most commonly an adenoma. Pathogenesis, most commonly it may be due to an adenoma in the pituitary gland. What is adenoma and what are the features of adenoma you will learn in tumors of pituitary. So first let us only concentrate with the hyperpituitarism. So it may be due to adenoma. There is increased growth hormone production before puberty. But this may lead to hypopituitarism later, because the body, whenever there is increased growth hormone, the body becomes large and he becomes more weight, more height, increased weight, increased height. So the need for pituitary hormone increases. So the pituitary adenomas can't suffice that need. So this results in hypopituitarism. So due to hypopituitarism, there will be muscular weakness and other signs of hypopituitarism follows. I hope you got it. The main thing is there is an adenoma. Due to this adenoma, there is increased production of growth hormone. This adenoma develops before puberty. So obviously the increased growth hormone occurs before puberty. The body will be large and the weight and height also increases. He becomes really obese and he will be some 200 kgs weight or 300 kgs weight, and his height will be around 2.7 meters or 3 meters height. And the body tries to produce pituitary hormones like not only the growth hormone but the other hormones which are really important for the maintenance of the body. But as those hormones are not sufficient for that large body, the body develops in hypopituitarism. So this leads to muscular weakness and other signs of pituitarism. All these are the pathogenesis which occurs in the gigantism. So the only there is not much treatment for this in gigantism, but the persons are given pituitary hormone supplements for this. But the treatment part, better you will learn it in general medicine and things. First, in this pathology, just concentrate about the pathogenesis and the lesions which are seen. So the second one which you would, whenever there is increased growth hormone, is acromegaly. So whenever there is increased growth hormone, one is gigantism occurs, where there is increased growth hormone before puberty, and the second one is, I'll write here, and the second one is acromegaly. What is acromegaly? Acromegaly, even this is usually because of adenoma in the pituitary gland. Whenever there is some adenoma, first let us discuss pathogenesis. Here in acromegaly, there is increased growth hormone after puberty. It can occur in me, in you, anyone after puberty. Here the main pathogenesis is adenoma or hyperplasia of growth hormone cells. There may be adenoma or there may be hyperplasia of growth hormone cells, which leads to increased secretion of growth hormones. Right? The main reason of increased secretion of growth hormones is because of adenoma or hyperplasia of growth hormones. That is, there is increased when there is one growth hormone cell which is one somatotroph, but it divides a lot, and then this leads to hyperplasia of the growth hormone cells, and it also leads to, or it may be due to adenoma. So both these leads to increased secretion of growth hormones. So this is pathogenesis. So what are the lesions and how would it manifest as? So this here the body becomes enlarged. Really sorry for the inconvenience. Here lesions. First, body enlarges. Body becomes large, and hands, feet also becomes large. and they'll be soft, right? The lips, ears and nose will be small. See, lips, ears, nose, all these are large or big, but skin will be thick and fleshy. On the skin there will be increased wrinkles are seen. Increased wrinkles on skin, and there may be increased sweating. So skin may be hyperpigmented. There is increased pigmentation may be seen, and bones may be thick and coarse. Lower jaw protrudes. Supraorbital ridges will be prominent. And all the bones elongate, bones of the chest, bones of the thigh, bones of long bones, all the bones will become elongated. Like I said, bones, it's not both, its bones are thick, coarse and even elongated. All the bones become elongated. So this elongation may even leads to osteoporosis, because the bones become elongated, but the calcium reserves which are necessary for the person becomes decreased, because the need increases, the demand increases, but intake eventually become normal, will be normal. So this leads to osteoporosis in the later stage of the disease, and myopathy and peripheral neuropathies may also result. So all these are the lesions which are seen. So let us draw a diagram based on these lesions, because everyone can just by heart these, but if you draw a diagram, you'll remember it for long. So the first one is body is large. So first let us draw a normal person. 2 eyes, 1 nose, 1 mouth, and with normal ears and normal hair, right? So with the normal limbs, these are normal, his normal limbs and his 2 legs, and knee and normal leg, right? And this. So this is a normal person. So his eyes, his ridges, all this will be okay, fine. So let us draw a gigant person. He will have a large body, right? First of all, a very large body, fine. And he will have his hands and feet are also very large and long. See, I said it's long bones, so he has a long bones, and even his hands bones will be very long. This is his body. Even his legs bones will be very long. Right? Even his leg bones will be very long. It's like long bones, large body, if you just take its face is also large, with large eyes, and his nose will also be large, and lips will be larger than normal. And his ears will also be larger than normal. Right? All his body parts will be large. If his skin has this thick with stratum corneum, stratum germinatum, all those layers, his skin will be a large, much thicker and coarser skin. This is thick skin. And skin is hyperpigmented. There will be hyperpigmented patches everywhere. This lower jaw will be protruding. Protruding lower jaw. And finally, the supraorbital ridges which are present are prominent. I just wanted you to remember everything through diagrams, because by hearting everything doesn't make sense. So I have just drawn a diagram about the pituitary adenomas, though if there is any mistake or if I'm not a good artist, so I just made the differences between a normal person and the person with gigantism so that you can understand it. And I'm planning to make videos of different photographs so that you can understand it, but it takes time. So this is what we are mainly going to see in are the lesions which are mainly we are going to see in acromegaly cases, that is increased growth hormone after puberty. So what are the clinical features of this problem? Because it's necessary for every one of us to know about the clinical features, because this is what the patient presents with. So the main clinical features of this syndrome are there will be increased sweating. As I said, there is increased sweating, increased tissues and bones. As you can see, just by just seeing the person, you can say that he's a person suffering with acromegaly. So all these are and he might be knowing that he had that problem, or if he comes to you for the first time, you can just say it by just seeing the person, seeing how he looks, how his problems are. And he might be suffering with muscle pains, because muscle weaknesses because of his long bones and his due to his long bones and large body, he may have muscle weaknesses, joint pains and paresthesias. All these might be there. So this is the clinical features which you can see in a person. Just by seeing the person, you can clearly say that he might be suffering from gigantism, he might be suffering from acromegaly or some other problems. So what are the dysfunction? Which hormones you will see dysfunction of which hormones are seen in pituitary gland? Hyperpituitarism. So there will be increased growth hormones. So this may lead to insulin resistance. Why you will have all these problems is you can know by just seeing the lecture on growth hormone, which I have uploaded or I'll be uploading, I'm not sure of it. And there will be systemic hypertension, and there will be cardiomegaly, and there will be congestive heart failure if neglected. There will be hypercalcemia. There will be hyperthyroidism, because this pituitary adenoma or any condition may not only affect the growth hormone cells, but it may also affect the other cells. So other features will also be seen. There will be increased prolactin and sometimes amenorrhea, galactorrhea, or decreased libido can be seen. But why are these seen? Because of increased growth hormone. Growth hormone will not only increase the bone weight or something, it also has many functions which are seen on our heart, our body systems, our many systems of our body. So growth hormone not only causes increased bone density or bone weight, but it may also lead to increased muscle mass, so it may lead to cardiomegaly. It also increases the absorption of calcium and increased secretion of thyroid and prolactin. So these are the main dysfunctions which are seen in growth hormone. So this is hyperpituitarism due to growth hormone, which I would like to discuss in present class. It is of two types. One is gigantism and the other is acromegaly. Gigantism, it occurs before puberty. Acromegaly, it occurs after puberty. And this is the two different pictures which you can see. So this is a person, normal person, and this is the person with gigantism with protruding lower jaw, thick skin, prominent supraorbital crease, large body, long bones, hyperpigmentation person. And basically you should try to differentiate the person in the best possible way. In the next class, I would deal with the other hyperpituitarisms which we will encounter in our daily life. Okay, bye.